5, 4, 3, 2, 1.
Hello, Nomads. Here we are with another episode, one of our rare morning episodes. I don't usually see Cash at this time of the morning. I know he's not too happy about it, but it's probably the sexiest episode yet, so I'll let you.
Sex.
Sex sells.
We have Dr. Stephanie Buehler in the house today. She's a licensed psychologist, a product of UCLA, USC, Pepperdine University, and Alliant California School of Professional Psychology. She's recognized around the world as a master therapist, master sex therapist, and she is the founder of Buehler Institute, correct?
Correct.
And an author of many great selling books.
Yes.
A
couple of great.
Did they sell well? So thank you so much for coming in today. We appreciate your time. You honored us.
Thank you.
Please introduce yourself to the guests.
Okay, so as he said, I'm Dr. Stephanie Buehler. I'm a psychologist, an ASEX certified sex therapist, and I have a private practice. I'm affiliated with Hoag Hospital, which is our big hospital here in Orange County. And I see men and women from age 18 to 80. About half of my practice is couples. So, and I've been doing this for, I think, 16 or 17 years now.
Yeah, I was going to ask if people, is it always couples or actually people come on their own too?
People come on their own too. My preference is to see if somebody is in a relationship, to see them with their partner. Sometimes people are embarrassed, or sometimes they're angry at their partner, or they have something going on that they just don't want to talk about with their partner.
And you teach them how to let that anger out in the bedroom, basically.
Yeah, definitely. Well, sex and anger,
But what made you become a sex therapist? And be honest about it. Don't give me that. Right. I've always been fascinated.
No, you know what? I really, when I was going through school, I didn't have it in my mind that one day I'm going to grow up and be a sex therapist, because I do know people that say that.
Okay.
But I wasn't one of them. But I was always interested in sex. I mean, I really was, even from being a kid. And
interested?
I think
how?
Me too.
Yeah. Well, if I knew my parents had a book that they talked about in whispered tones,
I see.
Kind of figured out that there might be some sexy stuff in there. And
immediately wanted to jump on that
one. Absolutely. And I was just very curious about sexuality. So, and then when I was in my teens, this sexual revolution was going on. I grew up in the San Fernando Valley. That's sort of ground zero for the sexual revolution.
What was the sexual revolution, if you could just briefly?
Yeah. So around the time in 1960, actually, the oral birth control pill was introduced, and that changed everything. Before that, people really felt that they had to wait until they got married to have sex, and if you could have sex without causing an unwanted pregnancy, that was very revolutionary.
So the birth control pill actually revolutionized the game?
Wow,
did you know that?
I would say.
I didn't know that.
Yeah, so that was one thing. I think it was also Hugh Hefner.
I thought it was Prince, but
Hugh Hefner, with his Playboy magazine.
Okay.
Although he objectified women, he did, work to make sex, premarital sex, or just sexual expression more acceptable.
But back to you, you were saying.
Yeah, so anyway, so I think growing up there, I was exposed to a lot of people with all kinds of different sexual expressions. I had friends who were gay, who were trans. I mean, that was a long time ago, who identified as bi or queer even back then.
It wasn't even cool back then.
It wasn't even cool. No, it was a lot of people were really closeted about that. Right. And there was always a big discussion, who's in the closet, who's out. And anyway, so I was very open about sex and sexuality, but that isn't really where my head went as far as a career. I don't even know. I mean, was there sex therapy then? Yeah, I guess there was. There's Masters and Johnson. But anyway, so cut to I don't know how you cut to. So I was an elementary school teacher for 10 years.
Okay.
People go like, that's kind of weird.
Yeah, that's kind of creepy.
Yeah, that is kind of weird. Yeah. So, but even then, you know, I worked for LA Unified, and I was on a pioneering team where we taught kids and parents and staff how to recognize sexual abuse.
Okay.
So, you know, there's still, even though it's not really talking
Like,
about...
show me on this doll where he touched you.
Right,
kind of
right. So I didn't do that, but, you know, to encourage kids to come forward, that was like in the 1980s.
Mm-hmm.
You know, encourage kids to come forward if they were being sexually abused or abused in any way, to talk about it, to keep talking about it until they found someone to believe them. So...
It sounds like we're still not there yet.
We're not we're not there yet. I think we're going to get there, though.
Are we closer? Are kids more open about talking about stuff?
Yeah, I think so. I think that kids are more willing to come forward and say when something is happening that they don't like.
Okay.
So that's a good thing. Right? And anyway, so...
And I want us to go back to that at some point.
Yeah. So, you know, that was an interest in sexual trauma.
Mm-hmm.
But still not there at sex therapy. Went to school, you know, got my teaching credential. Then I went in and got my my doctorate. Still not thinking about sex therapy. Working with little kids.
Right.
Except that, yeah, it's like working with little kids by day and then going home to my kid at night. And I just went like, this is too much kid. I'm just I don't need it.
Babysitting 24/7.
Yeah. And my daughter, who's now 26, is awesome. But
Yeah.
she was a kind of a handful. I just thought, you know what? She needs me, and I don't want to give all my energy to kids. So I started working with people that had chronic illnesses. And from that, I started working with an endocrinologist. You know, endocrinologists are doctors that test your hormones.
Okay.
And she said to me, hey, you know, people come to me all the time and they say, you know, I think I need my hormones tested. I'm not interested in sex. And I think maybe I have low testosterone if it's a guy, or low estrogen if it's a woman. And you know what? It's hardly ever that. It's hardly ever their hormones. It's something else.
It's all mental?
It was mental stuff. I was going to,
Yeah, they want it to be their hormones because then, you know, you just
There's
give me...
There's a fix for that.
Right.
Give me a
There's
pill.
an easy fix. Yeah, a pill, a potion, something, right? Anyway, so she said, you know, if you learn sex therapy, then I can refer clients to you. And that was all it took. Refer clients to me? What a good idea. But it was more than that, too. I thought, that sounds really interesting because it's a real body-mind kind of thing, and it's working with a lot of medical problems, you know, people that have cancer, diabetes, that kind of thing. And again, because I've been very open about sex and sexuality, I thought, yeah, that sounds like a cool idea.
So you started competing with Viagra.
Yes. I remember maybe a couple of years after I started doing sex therapy, this guy came into my office. It was the first guy that had been prescribed Viagra, and he came in and he said, you know, I came home with the Viagra. I shook that bottle like a maraca. And I said, honey, we're in business. And my wife said, oh, my God, I thought we were done with that. And
she wasn't too happy. Finally, I got rid of this guy.
Done with that.
He's
I
back.
thought, okay, Viagra is not going to fix everything.
Yeah.
So, and that's true. That's the case.
Compatibility.
That's interesting.
Yeah. So, anyway, so that's kind of my long and winding road, if
Right.
you will. Feel free to edit.
Was there a lot of judgment in regards to becoming a sex therapist? You're one of the first ones in Orange County, correct?
Yeah.
If
I'm
not the first one?
I'm not the first.
Are you going to claim that?
No, I'm
First
not
in
going
the
to claim
game?
that. No.
Hottest in the streets.
No, there were a few other sex therapists in Orange County, but there were only a couple of us when I got my certification, maybe 3 of us.
So what do people think? I mean, are they ignorant about, she's probably a freak? You know, let's be real, yeah.
Yeah, I think so. I mean, I think especially when I got my certification 15, 16 years ago, you know, it was more unusual profession, and people would get mixed up and they think I was a sex surrogate, something like that. helped, like got naked with people,
Yeah.
or sex worker, or it's like
Or you can provide,
Sex worker.
you can provide sex workers,
right
to business occasions.
right.
What is the certification? Like, what is it based on? The science of it, or?
So there's an organization called the American Association of Sexuality, educators, counselors, and therapists. I believe that they're the largest certifying body in the United States, and you have to do a lot of stuff. You have to get 150 hours of education, 300 hours of clinical work, 50 hours of supervision, and you have to attend an experiential workshop called a SAR. I should talk about the SAR.
Yeah, I want to hear about the SAR.
Yeah, so
Experimental.
I've given SAR. Yeah, it's a unique experiential workshop.
What does it stand for? Sex.
It stands for
addiction.
Sex.
No.
No, it's it comes from the 60s. So it's sexual attitude reassessment. Right. Sounds kind of sick. SAR.
Yeah.
Anyway, so you get a group of people who want to get their certification for ASECT, and actually other people are welcome to come too. And you sit and watch sexually explicit material of all different kinds. And,
I'm an expert. No, I'm kidding.
Yeah. And from very mild
Where's my certification?
Yeah, to very wild. And then you sit and you talk about your reactions to
How
that.
wild are we talking?
We're talking.
Let's keep it
pretty
real.
Wild. Let's talk about people who like to have sex with animals.
Oh, shit.
Wow.
Yeah,
I don't wanna watch
that's
that.
pretty. Yeah, and then so you hear people talk about their reactions.
What are you gonna?
Yeah.
Yeah.
So
Yeah. This animal thing. Good thing you brought it up. We'll get back to it later for sure.
Yeah, definitely.
Just address it right now. Is
but,
it?
But I want to the certification. Yeah, let's talk about the animal thing. Priorities, people.
Yeah.
Yeah.
Listeners
Yeah.
want to
Let's
hear
talk
about
that.
animals. They don't want to hear about no
Is
SAR.
it a
let's
quite
hear about
common
animals.
thing? Because I feel like if there's porn out there, animal porn, then there has to be a lot of people who are interested. Is it very closeted or no? It's just.
I think. Well, I'm sure that it's closeted because it's illegal in I think every state now.
Yeah.
Yeah. So, but it definitely happens. I know, and some sex therapists will work with somebody who is into that, and some are like, nope, that's too much for me.
Yeah.
And that's okay. You don't have to treat everything on the planet.
Because
if you're a
there are
sex
these farms and ranches. I mean, I remember there was one in Oregon, and I mean, all over. Once in a while, one pops out that they pretty much just like an animal whorehouse. They go, look at their wide array of sheeps that we. This one's a little chunky. So I mean, I don't know how does that work. You just it's so strange to me. But
My co-host knows a lot about sexual experiences with animals.
Really?
Remember the Halloween episode with the people that wear bunny outfits and stuff?
Furries.
Yeah. I was
Furries.
like, shit, how do you even know about that?
I don't know about everything, but
Yeah. No, I mean, I saw.
We'll let
I
Arf
was
explain.
driving down Sunset Boulevard. So Saturday morning, I saw these two girls walking as furries, and one of them I thought she was pretty cute. I guess.
To say the
She was
least.
cute. It wasn't about the animal attire. But
paging Dr. Freud.
Since you brought up Freud, so the education level of it, is it based on old psychologists and big psychologists work, or is it? I mean, how dependable?
So, well, it's that's kind of interesting because sex therapy doesn't really have a theory behind it, so you kind of have to create it.
They don't have a theory?
Nope. There's no
Like-
theory of sex therapy.
So
there
you
are
use
different-
solution focused as a framework for sex therapy.
Yeah, so it could be solution focused, or it could be systems. So if you're doing couples therapy, you're looking at the system and the symptoms that are occurring.
Now, since Earth brought up models, what is the one that your go-to? Is it solution focused? And not to geek out on this, but
Right.
I'm interested to know.
So I have a book out there called What Every Mental Health Professional
Shameless
Needs to Know
plug.
About Sex. Yes, shameless plug.
You can
And
find it on Amazon?
You can find it on Amazon.
Okay.
And in that book, I talk about using a sexological ecosystem. I know that sounds really geeky.
Sexological ecosystem. Okay.
So macro, micro.
Yeah, so it's the microsystem, the macrosystem, the exosystem.
Okay.
Right, and so you're looking at what's going on at all different levels of a system,
Mm-hmm.
and then you're looking at the interactions between the systems.
Okay.
And then if you have a couple, you're looking at the interactions between the couple
Uh-huh.
and their systems. It's
So in the middle of it is how you perceive sex within, and then it's how you have it with your partner, and then how you have it with the
Other-
culture.
Multiple
Well,
partners.
no, it would be. That's macro. Yeah, that's. So the micro is like within, and it's also your family. Because we get a lot of what we learn about sex from our family, the messages that we get. And some people grow up in very open, progressive kind of families, and some people grow up in much more
shy,
strict
shame.
families.
So that's where shame and guilt comes from, right?
Yeah.
I mean, it almost feels like shame and guilt goes hand in hand with sex for the most part. I dealt with a lot of it myself, growing up with a religious mother. So I bet a lot of your clients deal with that.
Yeah, they do. Absolutely.
Right.
People come in, they've grown up in different religions that are very restricted when it comes to sex.
Right.
So many religions are very, how can we say?
No
They're not
sex
anti-sex.
before marriage.
No sex before marriage. And even
one
no
partner.
masturbation
Yeah.
before marriage, right? No self-pleasure before marriage. So, and then the idea is when you meet,
What a form of control,
Imagine like never anything, just that you meet somebody.
you meet somebody and the idea is when you get married, it's all supposed to come together.
Yeah.
Right? It's all supposed to work, and you're supposed
That's
to...
when it all falls apart,
That
actually.
sounds
Right.
so.
And that's right.
That
That's where
sounds
it
that sounds
falls
really
apart.
wrong, doesn't it?
Yeah.
It's almost like they're holding your balls and they're like, "Hey, it's ours now."
You can't even hold your balls. That's against.
Right.
No.
So, you do get a lot of people. I get a lot of people coming in maybe a few months after they've gotten married, maybe 2 or 3 years after
Right.
they've gotten married, and things just are not working.
Okay.
Yeah.
So, and part of it is because there's a lot of shame. There can be dysfunction,
How do you address that?
How do you address this shame?
The shame and guilt.
Yeah, so...
And it's a workable thing.
Right, it's a workable thing. I mean, it's to have people recognize how that happened, how those beliefs about sex being shameful were passed on to them.
Okay.
It's even things like sexual neglect, like not being told anything about sex at all.
Yeah.
Nothing. Or being held back from going to the sex education class that most people go to in 6th grade or whatever.
Yeah, I never had any kind of conversation about sex with my parents.
You didn't have the beast conversation?
No, I mean actually, it was like specifically about beasts one time. Like that's the funny part. We're watching a documentary with my dad.
It was literally about bees?
Literally, it was a documentary, and then it was something about like the queen was having eggs and stuff like that. So I asked my dad, and I'm like, "What's going on?" So where do babies come from? And my dad, he's a professor, and he said it in the most complicated way. Word that I wouldn't understand basically, and then that was about it. No other conversation. I had to learn on the street.
Did you have that conversation?
No.
Yeah.
No. it didn't happen.
Yeah, in our culture, they act like it doesn't
right,
exist.
yeah.
Yeah, my mom said she prayed and I happened.
I
I still believe that.
Yeah. You have these Jesus things about you. And I'm just,
Wow. Okay.
No, that makes sense. Actually. It's possible.
That's like
Not too
beyond a
far-fetched.
virgin birth. I mean, that's I prayed.
So yeah,
There you are.
he spoketh, and there you were. Yeah.
Yeah.
sounds
yeah.
like a cheating husband explaining to his wife how he had a child from a different baby mama.
Yeah, right. Oh my gosh.
But how do you address it?
Yeah, so we just have a conversation about it and help a person have developed their own ideas about how to have a healthy attitude towards sex.
Okay.
So, we might talk about the body first. How do you feel about your body? If you have shame about your body parts, your sexual function, any of that. And we might address that and talk about that. I know, for women, a lot of women have no idea what their anatomy is. So we might talk about that with some diagrams and educate them and help them understand what normal, healthy sexual function looks like.
How long does it take to do that?
It depends. I mean, some people are highly motivated. They're pretty sophisticated in most regards, and they want to get this fixed quickly. So, it might be like 6 to 12 sessions. Other people are much more repressed, or they're repressed and there was a problem like sexual abuse
Mm-hmm.
or something of that nature. And so that's going to take longer, maybe 6 months of treatment, sometimes up to a year.
Yeah.
Mm-hmm.
Wow.
Mm-hmm.
Yeah. And so people come with problems that say they think there's something that's maybe too freaky or they shouldn't be into, and they ask you like, I think I need help, and they're ashamed of it, and
Right. So
How do you
most
deal with
people,
that?
I think it's kind of interesting. When I first started, I had a lot of people coming in going, "Oh, I'm doing something freaky or weird." Not as much
you're like, that's
anymore.
nothing.
Yeah, well, I
After
think,
they tell you.
they can find each other on the internet, right? So there are communities, and I don't
What
think they
websites
feel
do you
as weird.
recommend if you want? Okay.
So there's
Yeah.
Kinkster.
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 write that.
That's one where people who are kinky can go and.
So the internet
interact.
normalized the sexual taboos
Yes.
and the fantasies,
Yes.
and one can argue that even pushed it further. And
Oh,
Yeah,
There's no
maybe,
argument there, yeah.
right? So and made
is that
it,
healthy?
You know what? As long as somebody is doing something that they find
How much
fun
porn is
and they
too much
don't
porn? I
hurt
think that's the
anybody.
But that's subjective.
Very.
So,
Very.
but it sounds like you don't want to put your foot down and take a side because you're so understanding and open to everybody. But at some point, can you just say, well, look, this isn't right, or maybe you should kind of hold off on maybe having sex with too many sexual partners, or no?
in general,
There
one
isn't
day?
such a thing as that?
No. You know what? I think that, for sex therapists, they really are open to people's sexuality and sexual experiences. And it's up to the person to decide what their values are.
Okay.
Okay, so if somebody has many, many sexual partners,
Mm-hmm.
and if they are uncomfortable with that, then we might talk about their values.
Okay.
All right. But sometimes people have many sexual partners. They're happy.
Mhm.
Right? They're not.
I
They're
think they're
not
all happy.
complaining.
I'm
No.
joking.
Some people
Because a
come
lot
in-
of it don't do it because of the sexual pleasure, I would imagine.
Yeah,
It's
right.
because of daddy issues or whatever that may be, but they're just trying to find love in a different form.
Right.
Uh-huh.
Or some people just like a lot of sex.
Yeah.
Mhm.
And they like a lot of variety.
Right.
And so they have many partners.
So it's
Now-
intention.
Yeah. Intentional.
As long as the intention is good, it's good, basically.
Right.
That's what
And
we-
it's consensual and intentional.
Now you're
And
going
they're
too far.
enjoying it. Yeah.
I don't know
Right.
nothing about that
Yeah,
consensual.
yeah. And I mean, somebody comes in and they've said, they've had maybe 100 partners.
Yeah.
I might say.
What do you say? Do you clap or you're like, get the fuck out of here?
100 like
I go-
total lifetime or
Lifetime, yeah.
well, I'm just asking.
Which is way above the average.
Right.
Okay.
For the average American man, it's 6 partners in a lifetime.
Really?
For the average American woman,
Some good
it's
men out there.
4.
There's
So if
some
somebody
good
has, that many partners, then I am wondering, okay, what's this person's
I
deal?
see.
Are they enjoying themselves? Or
Mm.
are they doing it out of some compulsion? Does it feel like empty to them, or is it something that is fulfilling?
Mhm.
And
That sounds sexual. But okay.
yeah.
So where do you fit within that scale,
Yeah.
Erf?
I don't know.
Because
man.
I'll tell you, my question is like, do you lose it if you don't use it? Because I feel like my virginity is growing back. But you can talk about.
No, it's like riding a bike.
Oh yeah,
Always
right.
comes back.
Yeah. Don't ride your bike too much. That's bad.
Now, do you find?
Go
Do
ahead.
you have a question?
Go ahead.
Do you find the issues to be a lot different between men and women? Because there is a major double standard, and I think it's
Who's
it's-
more freaky?
It's pretty unfair with women, probably. So they would I would imagine that they have a lot more sexual difficulties
No,
Or
what?
challenges.
It's really
because of the society.
It's really 50-50.
Mm.
People are really all like surprised to hear that. But men get a lot of negative messages too.
Okay.
Theirs kind of go the other way, where they feel like they have to be macho, they have to bring it to every sexual
Yeah.
encounter, right? Whereas women, because of our anatomy, we can kind of fake it, kind of go along.
Okay.
So you have a woman who's been married, say, 10 years, and she's kind of bored with her sex life, but she's not assertive. But
Mhm.
she can kind of go along, right?
Yeah.
So, whatever. But guys, it's kind of obvious for them,
Yeah,
you know,
you can't
the
fake
sex
that
organ
shit.
is there, right?
Yeah.
It's right there in the middle of their body, so there's no getting around.
We can't fake orgasms and,
Right, right. Although I have heard of men faking orgasm, which I don't know.
How
does
I
that
don't know
work?
how that looks, you know.
You got like
It's
something
like-
in their pocket too.
Yeah, how does that work?
Turkey baster. All right, so what are some of the strange, I don't know if it's stranger, but like, more extreme things you've heard from clients?
So, more extreme things.
The fun stuff the listeners would like to hear.
Fun stuff listeners would like to hear about. Well, you know what? It's hard to talk about those things without somebody listening going, oh, that sounds like me.
I see.
Right?
What about some stuff your colleague heard?
Right. So,
Yeah, your friends.
Yeah. So I have one colleague who really likes to work with adult babies.
Oh,
babies,
yeah. That's the
right?
thing, right?
Right. That's a
love
thing. And it usually is. There's usually a sexual component to that.
So they
Right,
dress as
yeah.
babies. And,
Right. Or they like to wear diapers.
Yeah.
And use
Be spanked.
diapers as part of, and maybe.
I bet Freud would have
yeah.
loved to talk about that, huh?
Yeah.
Have you even seen they have like the giant
So-
cribs and stuff like
Yeah,
that?
they do. Yeah,
Well,
yeah.
They go full role play, yeah.
Yeah.
And then some people are sexually attracted to them. Is that or no?
Yeah,
that's
or
just,
you know, they might have like a partner who's.
Also a baby?
Yeah, they might also a baby, also into diapers. You
Mhm.
know, I have heard of like a couple.
like it
that's-
turns her on to wear diapers.
Yeah, it turns them on to
So-
wear diapers.
Interesting.
So right, that's interesting. But again, if people like doing that
Mhm.
and they're happy doing that, they're not going to come into my office. I
Ye-
don't have people
oh, I
coming
see.
in saying, I do this and I'm sick and weird,
Yeah.
so fix it.
They say, I feel guilty about it or
I
something.
feel guilty about
strange,
it, or
yeah.
strange,
Yeah.
or something like that. But it's kind of rare. I mean, most people feel good about that.
Yeah.
And what do
yeah.
you say to them
I
when
say,
they feel guilty?
well, is it bothering you at
Yeah.
all? And if they say no, then okay.
Okay,
You're fine.
Hmm.
that's it.
What
Good
else?
for you.
What else? He wants to know more.
What else? I want the weird
What
stuff.
else? Let's see. So, what else is unusual?
Bondage.
You know what? Something that I think a lot of guys come in and talk about is the fact that they're looking at pre-surgery transgender or pre-bottom surgery transgender.
Pre-bottom, what is that?
Meaning that they're men who are in transition to becoming women,
Okay.
and maybe they've had top surgery, but they
Oh,
haven't yet
okay.
had
They
bottom
haven't removed
surgery.
the penis, but they have
Yes.
the boob
So
job.
Right,
these
so
people
they've
are the
got-
ones that are about to get into an operation and they come to you?
Yeah, well, no.
People
it's
who are
the
attracted
guys
to them.
are attracted to that.
Okay.
Mm.
Yeah, so, and they might start by looking at pornography with what, it's
Little
very
Thailand trip here and
derogatory.
there. you know?
Right, a little trip
Come-
to Thailand. I have, yes.
Yeah.
Heard of,
Bangkok,
going to Bangkok.
literally.
Yeah. Yes.
But isn't
Literally
Thailand,
going to Bangkok. Yeah,
Yeah.
so, and sometimes guys are very confused by that. They're like, why do I like this? I mean,
Yeah.
I'm not gay, but, but it really fascinates me. I find it very arousing. I have had guys decide to try to find somebody to hook up with and have sex with.
So
And-
do you have any patients that, that you can hook me up with? That's so funny. I'm saying they ask you like that kind of stuff.
Yeah.
But
yeah.
yeah. So what's your answer to them?
I don't really have a good answer.
Again, if it feels good, if you like it, it's fine.
If it feels good and you like it, that's fine. There can be a struggle with understanding what's one's orientation, okay, and understanding why, like, what does it mean about me? Am I gay if I like this person that has breasts and a penis? Does that mean I'm gay? And I'm always like, I don't know if it does, because we're talking about something rather unique.
Right.
So I talk about the fact that we have kind of a galaxy of sexual orientations
Big
and
gray area.
genders. Yeah. And so people are located, it's not so black and white.
Everybody's a
Not
little
s-
bit gay.
Yeah, everybody's a little bit gay or a little bit queer. I don't know, how to talk about it. But,
And the variety is kind of come more into light in the past. I feel like 5-10 years. Because I feel like every couple of months there's something new. I'm like, oh, what's that?
Yeah, right. I think so. I know that I hear from therapists, because I don't see teenagers, but from therapists who do see teenagers, that they have a lot more teens coming in and identifying, oh, I'm a lesbian, I'm gay, I'm bi, I'm queer, I'm this.
What's
I'm
queer?
That. Queer means not really identifying as male or female, or not. Okay. I'm not really sure what my orientation is yet. They might be questioning things.
Oh, I always thought that's like the same as gay. But,
I thought so too.
Yeah. Okay, good.
I think it used to be like a derogatory term for being gay. I mean, when I was a kid, like calling somebody queer was like, I
felt dumb for a second, then you saved me. I guess generally a lot of people do think that.
Yeah, that's what I thought.
Yeah, they kind of took back that term.
But that's our LGBT. Ignorance. Oh, they took it back.
Yeah, they sort of took it back.
Good for them.
Yeah.
Interesting.
Are men, well, first of all, you're very accepting with just all scenarios. There's some sort of there's a beautiful accepting energy about you, which feels spiritual. Do you find your work to be somewhat spiritual? Is there a parallel between being a sexual healer and a spiritual worker?
I think that a lot of therapists feel that their work is spiritual, whether they're working with sexuality or something else. I know for myself, I think there is something spiritual in accepting oneself and overcoming shame and guilt, because I don't believe that's the state that we're supposed to be living in.
Right. It's a fear-based state, which you try to say, ignore that and try to look within, and self-love, I would imagine.
Right. So
is that masturbation, or is that something?
Both.
Self-love.
Right.
Yeah.
And so, for therapists, we're supposed to be thinking about our client's spiritual path and not imposing our own spiritual beliefs. But I do think I bring my spiritual beliefs in because I think, there's like to have self-acceptance as part of my spiritual understanding. And compassion, absolutely. And helping people develop self-compassion. That's That's
where healing begins.
It really is, yeah.
Now, our producer wants to know, Cash, are men hardwired to cheat?
Oh. Are we trying to find?
I mean, on a evolutionary, on a evolutionary stance, some people try to justify it that way. They say it comes within the biological origins.
Right.
Is there a truth to that?
Because you can look at nature and see that, a lot of animals do that, but I mean, there's animals that don't. There's like matriarchal,
or like thousands of years, the guy that was actually responsible for most of the kids, or was the one that got a lot of recognition, and he was a valuable asset to a tribe, right?
Right.
So, so what do you think about that? Is that true? A lot of people ask that question.
Yeah, So my understanding is that there are some studies that suggest that, some men seem to be hardwired to have brain differences that make them more susceptible to wanting to be with multiple partners. Okay. But on the other hand, see, the way I look at it is, like going to work is unnatural, right?
Okay.
Putting on a tie is unnatural. So, but we do it, right? Marriage is, I think, kind of unnatural.
Yeah,
too, right? But we do it. And to me, the most important thing is that partners have an agreement about what monogamy, or whether or not monogamy is going to work for them, and to have open dialogue, if they are monogamous, about the challenges of being monogamous.
Yeah, let's talk about that, because I'm fascinated by open relationships. I used to be so against it out of ignorance, but then I started realizing that a few of my favorite people have open relationships, and then I try to listen to it. And they talked about how they have to overcome so many barriers that regularly most people can't, which is things such as ego, honesty. They have to be very honest with each other, probably more honest than an average partner. And they have to overcome jealousy, which is something we all deal with, and insecurities. They have to overcome all that to make it work, which I would imagine is a big reason why open relationships don't work a lot of times. But when they do work, there's something in there.
Right. So I suspect that there have always been open relationships,
Mm-hmm.
partners that have had agreements,
Mm-hmm.
that they can be with other people.
Okay.
Right. So, and also cultures where it's common, it's maybe not spoken about, but it's accepted.
Okay.
So you think about like French culture, not that everybody in France has,
but in general.
but in general, right? I think an open relationship is not a good Band-Aid for a relationship that isn't working.
Right.
Right. It's really for a couple that feels that they have a pretty good relationship, but they find monogamy very challenging. And so they have an open discussion about it. They set up rules about what is and is not okay.
Mm-hmm.
And like you said, they have to be incredibly honest with each other.
Yeah.
Yeah, I have a good friend of mine. I've known her for years, and I've been involved with her here and there at some points.
In what capacity?
Sexually.
Okay.
Yeah. Topic of the show.
What
I
are you
know.
gonna
I was trying to kind of leave it out.
Oh.
Yeah, I do. I put the spotlight on it, but
What's her name?
but yeah, basically, she told me about this. She's like, she's in an open relationship with a boyfriend. She's been for a long time, and it was kind of, I don't want to say shocking, but it's very interesting to me, and I wanted to actually hear about it. And she explained it to me. It seems very honest because in a lot of monogamous relationships, there just honesty isn't there, and a lot of times maybe you can't even express yourself the way you want.
Mm-hmm.
There's some honesty there. I mean, again, I don't know if it's necessarily a good or a bad thing, but whatever works for you.
Right, exactly. Whatever works for you. I mean, when couples come in and they say, we want to try an open relationship, I really want to emphasize to them that if their relationship is not working and it's dysfunctional, this is not
the answer. It's probably going to make it worse.
Yeah, because there are so many challenges.
Throwing a wrench at another non-functional wheel.
I can't do it.
No,
I can't imagine it. Yeah, if I have feelings for somebody, I can't imagine them having sex with another person and being okay. Come on, be back before 4.
I really thought about that to myself, and I started having an open mind about it. I was like, okay, so I got past my the way I used to look at it, and I realized for me it's the exclusivity that really matters. So then I realized it's not maybe for everybody, but I respect it now for the people that do have it.
Right, and that's kind of the way I feel. I mean, I've been married to my husband. It'll be 32 years next March.
Mm-hmm.
We've been monogamous for 37 years.
Mm-hmm.
So a long time. Every once in a while we go like, it might be fun to have an open
I judged you so
relationship.
hard in my head. I was like, for sure she has an open relationship.
Really?
Because you're open-minded. I was like, open relationship.
Yeah, but
So
for us,
forgive me for that.
Yeah, that's okay. But for us, it just doesn't feel right for us.
Right.
It's
not
we
natural.
like being exclusive.
32
So
years.
you run things, you're the expert. You're like, this is how it's gonna go down.
but I mean, for me, it says, what? It is possible to be monogamous for many, many years.
Yes.
Mhm. It is.
It's challenging. Not gonna lie.
I'm absolutely monogamous in my relationships. I never cheat when I'm in a relationship. But seriously, it's not funny. It's not a big deal. But yeah.
What makes you great in bed?
What makes me great in
No.
bed?
I mean, if you want to get into that, we're open to it.
My husband, he'll tell me. What makes people great in bed?
Yeah, that's what I meant.
Yeah, so I think
Or is it?
really it seems that a couple of things. One is to be fully present when you show up, right? Because if you're distracted, if you're thinking about other things, if you're thinking about what you have to do tomorrow, or you're worried about a phone call that you have to make or that you just had,
You're not there.
You're not there. So you really have to be present and show up. I think you also have to know yourself, like know thy sexual self, and be able to communicate to a partner what you like and what you don't like. And I think you have to focus on your own pleasure. That's where people get hung up a lot. They're worried about pleasing their partner. And really, when you're touching your partner, you want to think about, if I touch my partner this way or do this, does this feel good to me? Am I enjoying it?
Yeah.
And kind of trusting that your
That's
partner.
annoying.
Yeah, I find that to be very true.
Turn off.
Mm-hmm.
If you're focused on basically what you're doing, you
Yeah.
know, and the passion is there, and you're really feeling it, you know, and that automatically turns the other person on too,
Right.
and it becomes better, you know, instead
Yeah.
of thinking like, oh, what should I do right now?
Right, because I
Yeah.
think it's a turn on when our partner is touching us in a way that feels good to them. It's like, oh, you know what, I can make
Yeah.
my partner happy.
Mhm.
I don't have to really do anything per se.
So
So-
be present, be willing to not only please, but also want to please yourself. Have a 9-inch penis.
Yeah, that's
No.
really critical. Yeah,
It's important.
I've heard like every woman who comes into my office says, "God, if only he had a 9-inch penis."
Hold on, you're kidding, right? I'm kidding.
That's so funny.
Right.
And ask questions.
Yeah.
Yeah.
But people they don't say that anymore as much as they used to, do they? Like I don't see the advertisements as much as I don't watch TV anymore.
Oh,
So is
like-
it still on TV
Yeah, I don't.
Oh,
see
like penis
that.
enlargement.
and stuff like that?
You know what? I don't.
It's been debunked.
It's been debunked for sure. I mean, there's not a good solution,
Mhm.
right, for that. And I think by now most guys know that.
Yeah.
You know, I mean, there are.
But it doesn't hurt to have a couple of extra inches, or
doesn't
does it?
hurt. I
It
don't
does
know.
hurt.
Yeah. Well, you know what? I mean, there are couples who are kind of mismatched. You
Right,
know, it's
yeah.
like, wow, he's huge and I'm small.
Hmm.
And that can be a problem.
And that's the thing too with girls too. The size is not like they could be a really tall girl, and be small, and then
Yeah.
you know, I
Right.
mean,
Yeah.
tight. I don't know.
Yeah. Well. Right.
And it could be like a very petite girl, you know, and not so much.
Right. Yeah. So, you know, helping a couple kind of work that out. Maybe they have to try different positions or something
Yeah.
like that. But does size matter? For some women,
Yeah.
it does.
Mhm.
You know, and so I mean, there are things that can be done with toys and extensions and you know that kind of thing. So
Yeah.
you know.
And I also think like during sex, there's certain, you know, like the I'm not getting really detailed, but certain positions when you get into, you know, that like this is the right position and this is, you know, everything's hitting where it's supposed to hit.
Right.
You know.
Right. So, and I think you know what, if we could talk about that.
Yeah, let's do that.
Like that's a problem that I see a lot, is that men have an expectation that their partner is going to or the woman has an expectation too, that she's going to have an orgasm with intercourse.
Mhm.
And really only about 20-25% of women have orgasm with intercourse, despite what you see in pornography or on, you know, even on HBO.
It's 100% every time in
Yeah,
those
it's
videos.
at
Yeah.
100%
I think I'm
every
hanging out with that
time.
25%.
Yeah. Yeah,
Um,
right. You know, so and even when a guy comes in and he says, "Every woman I've ever been with has orgasms during intercourse," I'm always like,
get the fuck out of here.
yeah. I think, well, you know what? I mean, women do fake.
Right.
I mean, they absolutely do. And I think if they think that they're with a partner who thinks this is really important,
Mhm.
all the more motivation to fake
Yeah.
it, right?
Mhm.
So, anyway, but it creates a lot of.
You could kind of tell though, no? I mean,
Well, those guys
I
obviously
think I
they
can.
lack
Yeah, I
awareness, though. I would imagine they're so much into their own whatever egotistical thing that is. I mean, you know,
that's a good point. Yeah, I think you're right.
if somebody
you're
has
right.
has enough arrogance to say that every single woman I've been with has that, I mean, come on, get
I
out of
know.
here. There's something else there.
Right? Yeah.
Yeah.
Definitely.
yeah.
So, you know, it causes both partners to feel inadequate or weird, like, you know, oh, everybody else is having intercourse and having orgasms, but,
Hmm.
you know, if we aren't, that means we're doing something wrong. And that's not true.
Yeah. Actually, I think if you actually really like your partner and have a bond, I think that's very important. You know, at least in my experience, it's been
Mhm.
like that.
Does sexual drive change as people get older?
Yeah, for most people it does.
So that's a real thing?
That's a real thing.
Okay.
It is. Yeah. So for men about early 40s, they may notice that their drive is starting to slow down. If it's really slowed down, they might want to go get their testosterone checked for sure.
Mhm.
Okay.
But for a lot of men, you know, like late 40s, something like that, they may say, you know what, I just noticed I've kind of slowed down. I don't feel the urge as often as I used to. For women, that tends to happen in late 40s as she's entering menopause. But, women are a little different from men anyway. Right? So a lot of women, it's like, I don't feel horny, but, if I'm in a good place and my partner approaches me.
Okay.
Then,
it's very mental.
Yeah.
And they would enjoy it.
Yeah, I'll enjoy it.
Do you recommend TRT, testosterone replacement therapy for men?
Well, if they need it, I think it's a good idea. They have to talk with the urologist about that.
Okay. Because I've noticed a lot of people in that age group are starting to be open to testosterone replacement therapy.
Yeah. So I guess there are some benefits for bone and heart health. But I always think, every man is different, needs to talk about that with their physician.
Okay.
I feel like it's a very ancient thing, and there's a lot of stuff that pisses me off. I mean, especially in Chinese medicine, tiger bones, the snake liver, blood, just all kinds of weird stuff that's out there. Then every single one, what it does is you make you, strong like a man. But but is there really herbal and natural medications out there that? Yeah,
so you have to be really very careful with those things. I think it was 60 Minutes, a very long time ago, looked at herbal things and what was in them, or even Viagra that was sold over the counter, over the internet. They found things like toner copy ink.
Really?
Yeah, and paint from powdered paint from road striping, and there's.
I've heard Tabasco. Remember Skip? One of our buddies said that this guy that used to work with us, and he was saying, someone would stick Tabasco up their ass or something. And give you an erection, if you're having trouble with it.
Well, speaking of that, you go.
Yeah, no, I was doing rather not.
I let people know that you're coming on the show, and we have a master sex therapist on the show on Instagram yesterday, and the most popular questions I got from girls was that, is it true that men's pleasure zone is in their butthole? Which was, first of all, very surprising to me. Why are women even interested in asking that question?
Guys are asking for some stimulation there. I don't know.
So is that the case?
You know what? I think that really depends on the guy. I mean, the anus does have, right at the entrance to the anus, there are a lot of nerve endings. Okay. So that can be a pleasurable place to stimulate. But I think other guys are no, thanks. Don't.
This is
weird.
No safe zone.
No safe
zone.
Exactly. Yeah. For sure.
In relationships, when if the sex is bad from the beginning, have you had any experience when it was bad in the beginning, then it got good? Because I believe that if it's not good, it's just chemistry's not there. It's probably.
Yeah, I think what, if the chemistry is not there, I think it is very hard you can't create it. Nobody has yet found a way to create chemistry. I do think though that sometimes couples marry. Say they're from a religion like Mormonism, where they have to marry before they can have sex. And then they find out, I love you, but this isn't very exciting. It's not the way that I thought. So I think they can be develop some techniques or develop some approaches to having sex that can feel good for them.
Okay.
So I think that's different though than a couple that, sometimes I get. More often it's a woman than a man, but sometimes couples come in and they say, well, we married and I knew that we didn't have great chemistry, but
I loved him. He's a good guy.
Loved him, a good guy. Often they say he's a good provider. He's loyal. He's stable.
Not in the bedroom. Yeah.
A good dad. I mean, that's really important to women.
Not a good daddy though.
Yeah. Right. Not a good daddy. A good dad, but not a good
It's a very, I feel, dark, bad place to be in. In a relationship, and it's just the sex is so bad or non-existent.
Right.
It's very
right.
So, any more interesting?
Well, I don't know about interesting, but I want to go back to what you initially mentioned in terms of people that have been victims of sexual abuse.
Yeah.
I had a relationship with a girl one time that was a victim, and I noticed that it really does ruin someone's life. Yes. So I had a complete different understanding of it ever since.
Yeah.
And I'm also interested to know that what are the ways that you help people that have had those experiences, but it's because it's very common, right? 1 out of every 4, 5.
So it's one out of every 4, and they say 1 out of every 6 men.
Okay.
So I have had both men and women who've come in. Not everybody who's been sexually abused has a problem with sex. So that's interesting to know, but some people do. And they can be triggered at any point. So I've had people who have had a pretty normal sex life with a partner, but then something happens. There's like maybe a stress, some change that has happened, maybe the birth of a child or something like that. And what they used to enjoy, suddenly their partner touches them and they're like, like
and
really
it brings
freaked out,
that
right?
Okay.
So that happens. I also have people who complain that they are dissociating, just spacing out during sex. They're not present. They're not there. Their partner notices. I've had people who've had aversion, like not wanting to have sex at all. So again,
is that asexual? Is that the same thing or not?
No, asexual is like an orientation where somebody.
We just like you don't have an orientation.
This is based on the trauma.
This is just not being getting turned on. Basically.
Right. So this is based on trauma, and so what to do will kind of depend. I mean, a lot of it really is educating the person about how this happens, why it happens.
Okay.
Right, that helps.
Well, I want to know how important is it for them to talk about it? Because a lot of times they don't want to talk about it.
I know, they don't.
Especially in our cultures where it's like, I don't want to ruin the family, but I feel like the healing will come from talking about it, at least in my little opinion.
Yeah, I think that's a good opinion to have. Some people aren't ready. You can't force someone to talk about it. But I think sometimes, even coming into therapy, to talk about how to get ready to talk about it. Okay. Like, for example, to talk about the worry about the impact that might have on the family. And, well, let's talk about that, what that looks like. Okay. Not everybody who comes in is someone that I suggest that they confront the person who did it. Okay. Or talk to the family. If they feel that they're not going to get support, or they think that they're going to get blamed for it happening. Then, let's not go there. That's not going to help you. Yeah. Right. But others, like maybe identifying, if they've never talked about it with anybody, maybe they can identify 1 or 2 people that they can talk to. Okay. Maybe a sibling or an aunt or an uncle, something like that,
So you feel like that could remove some of that weight off their shoulders slowly but surely.
Right. And get some support. So
it's interesting in the case of like serial predators. A lot of times after years one person comes out and then it causes a chain reaction and then more people feel brave and they step up and like Harvey Weinstein or a priest or stuff like that.
That's really cool what's happening, by the way, right?
I
think this whole child molestation ring.
I think it is really good. I think that obviously it's something that's been going on for a long time. Right. Women and teens receiving unwanted touch by men in power, and that's not cool.
It's a lot bigger than we think, isn't it?
It's a lot bigger than
on some deeper systemic levels of operation.
It's fascinating, especially to me in America. It's crazy. I feel like, how do these people have the balls and how do they get involved with this stuff and how do they not get caught for years? I feel like they have really strong laws here in general. I don't know. I think maybe in some other countries, the police system might be a lot more corrupt, you know what I mean? Or, I don't know. It's crazy to me.
But it is it's a thing, isn't it? Amongst high ranked people.
Yeah, absolutely. The abuse of power, right? And seeing a woman, and it happens. I'm sure that there are men. Kevin Spacey. Yeah. Right. He had guys coming out and talk. Yeah, it was very disappointing. But somebody is in a position to help you with your career, and your career is very important to you. It's scary when it happens, and confusing, And, you don't want to tell anybody because you don't want to be seen as the whistleblower, right? And you want to preserve your career as much as you can.
And the judgment you're going to get from people, oh, he's doing it for fame. I mean, Corey Feldman, how many years was he talking about it? They're finally willing to listen to him.
Right?
Yeah.
So, yeah, it's a very sad situation. I think, there was that campaign, Me Too.
Yes.
I know for myself, I worked at a news station long ago, and one of the reporters asked me out. He was old enough to be my father. I was really young. I was 21.
Wow.
And he asked me out, and I thought, this is kind of weird. Why is he asking me out? Oh, well, maybe he's going to be a mentor. That's what I thought. He's going to be a mentor.
Sure.
And we went out to dinner. It was appropriate. And then we got in the elevator to go back up to my apartment, and he just completely
lost it in the elevator.
Locked lips with me, and I'm going like,
oh, no.
Whoa, this is weird. I said, you know what?
Don't do that, buddy.
Yeah, don't, like,
whoa.
I'm going, you know what? I don't have daddy issues, so I don't need this. I'm like, just like, okay. I actually think he was very embarrassed, but I never told anybody.
How old was he? Maybe like 40?
You never told anybody until when?
50 or something. What is that?
You never told anybody until when?
I never told anybody until that Me Too campaign.
Oh,
wow. I said, okay, you know what? I had something happen to me too. That was a long time ago, but that wasn't right. That was gross and never should have happened.
Do you want to say his name on air? No, I'm kidding.
No, I can't remember, but it was. It was on a major news station. So.
Wow.
Yeah.
Wow. Do you have any particular questions left or no? Because I think we're close to that hour mark.
No. I think I had all my questions.
I would love for you to speak a little bit about your institution and the things that you do. And we are an Orange County-based show, at least for the time being, in Southern California. And you're one of the biggest names in the game. So, so please feel free to speak on it, and let's get you some clients.
Oh, thank you.
Clients.
More clients.
Yeah.
I have lots
like
of
you
clients,
need any more.
right? Yeah, I do. I have a very busy practice.
But you literally hand people certifications. Like you're the master sexual therapist that makes other sexual therapists.
Well, I help, right? So
you're like the pimp of the game.
Yeah, something like that. So I do have a continuing education program. Right now, it's I have people from all over the country signing up to do my sex therapy training, which is the educational part of the ASEX certification. And the reason is that a lot of it is online. So I have two programs. One, they can just take 75 hours of training online, all online. And then I also have a blended program. So that's 105 hours of training online.
Okay.
And then they come to beautiful Newport Beach, California, and hang out with me for 2 weekends and do some of the live training that they need in order to get certification.
Like literally watching some porn videos.
Yeah, literally.
Yeah. No? I thought that's part of it.
No, that's the SAR. That's a separate.
You don't do that.
Yeah.
I apologize.
So, animal porn.
So, yeah, right.
So then they spend 2 weeks with you?
Two weekends with me.
2 weekends with you.
Yeah, and we talk about things like sexuality after a diagnosis of cancer, or working with LGBT clients and learning about the transgender client, and all kinds of different things. And,
okay.
Yeah. So.
And then they get a certification.
Yeah, they turn that in along with other items and other things that they have to do for ASEX certification. But that helps them knock out a big chunk.
It's a growing demand, isn't it?
It is a growing demand, definitely, because I think people are recognizing. Well, first of all, as people are
more
aging.
Open. Oh, okay.
Yeah, that's one thing. People are aging, and as we age, like baby boomers especially, want to stay sexually active, but they need some help with that sometimes, right? People also divorce when they're older, and they want to get it going with a new partner, right? And then I think too, like you said, people are more open. They're more likely to seek out some help.
It's more okay to speak about, sexuality.
Yeah, definitely.
Not to mention that if we want to talk about Freud and his psychosexual theories, then being a sex therapist seems like the right way of going about a lot of things in regards to therapy. And we're starting to realize that finally, if we still believe in Freud's theories, which we still do because we still talk about it.
We still talk about it.
Right.
And I think that, I think people are realizing that if you're not happy or don't have sexual satisfaction, it can affect all different parts of your life. Right? Like it's hard to feel like a success if when you think about your sexuality, you feel damaged in some way or inadequate.
That's true. All right, that was beautiful. Is there anything else that you would like to talk about, Dr. Buehler?
I think just that if people want to learn more about my practice or the continuing education, they can go to www.thebuehlerinstitute.com.
And we're gonna put a little thing under.
Awesome.
Yeah.
And for your books, I mean, I wish we received some signed copies, but now we can
that's
support and
right.
go buy
I'll
them.
send you. I'll send a couple of copies here.
Yeah. And what are the name of the books?
So I have two that I'm really promoting. So the first one is really a textbook. It's called What Every Mental Health Professional Needs to Know About Sex. And
so for the academia side, kind of.
Yeah, that they can find on the site, or they can find it on Amazon. They should get the second edition because that's updated. And then I have another book coming out in February called
60 Grays of Shade.
No. Called Counseling Couples Before, During, and After Pregnancy.
Okay.
Sexuality and Intimacy Issues.
That's a big thing.
That's a big thing.
That's a big thing. I have a lot of people coming in at that time or complaining. That's when our sex life went off the rails, like after we had the first child or when we were trying to get pregnant. So
yeah, no, I had that with my third baby mama. No baby mamas.
So they can look these books up as well.
Yes.
All right.
Okay.
Well, thank you so much again for honoring us with your presence. You're such a beautiful spirit. I could just feel the energy. Thank you, and hopefully we'll be in contact with you and we can get you back on the show at some
that
point.
would be awesome.
Thank you, my dear.
Okay.
Yeah,
Thank
can't
you.
wait to have
Thank
you
you for
back. It's a
having
great
me.
episode, so
Thank
much
you,
fun.
thank you.
And don't forget to subscribe.
So
And that's about it.
Yeah.
Nomads out.
Nomad out.
thank you, loves. Goodbye.
Thank you.
Okay.